The title is Healthcare and Retirement. And so, give you a general outline of what we're going to talk about. We're going to talk about healthcare costs and retirement. We'll look at Medicaid. We'll look at premiums, what's covered. Just so you know, and this is probably not a surprise, but healthcare costs have gone up over time. And when you consider that retirement may be 20 or 30 years, this is something you need to plan for and ask yourself, do you have sufficient assets to pay for your healthcare, not just when you retire, but throughout your retirement? And the reason why we ask the question is because those costs can be significant. The projected lifetime cost for a 55-year-old couple is over $1 million. And in 2020, a 65-year-old spent over $12,000 in their healthcare expenses. So that's why we're asking you the question. Now, one of the ways you can meet your healthcare expenses in retirement is through Medicare. And there are lots of details in Medicare. It can be very complex. So let me just kind of give you some basics so you can understand what this is. And generally, when it comes to Medicare, you're generally eligible at age 65. Now, Medicare has some different parts. There's A, B, C, D. It really is alphabet soup. There's lots of alphabets, and there's more, by the way. And then there's a bonus part called Medigap, where you'll see some more alphabet soup. Part A really is hospital insurance. So we're talking about hospital visits, things like inpatient hospital care or a skilled nursing facility, lab tests, surgery. These are the things that Part A covers. Now, typically with Part A, there is no premium. And the reason why is because you've already paid those premiums throughout your working career. So if you're eligible for Social Security, you are eligible for Medicare Part A premium free. However, there is a deductible, and that's a $1,600 deductible. What's key to understand here is that this is per benefit period. A benefit period is basically 60 days after you are released. So notice that this is not an annual deductible. It is a per benefit period. So if you went into the hospital in January and then you got out and you went back in June, there's an additional $1,600 deductible. What you will also notice is that the longer you are in the hospital, the more you are required to pay out of pocket. And one of the things you'll discover about what we call original Medicare is that there is no out-of-pocket maximum. Part B is what's known as medical insurance. So think about doctor's visits, think about preventative care, lab tests. So when you go to the doctor, that's typically what Part B covers. And there is a premium for Part B, and that premium is $165 per month. And that's where it starts, roughly, about $165 per month. And then you see there is an annual deductible of $226, and then it's 20% co-insurance. So what does that mean? That means if you get a bill for $1,000, they'll pay 80%, which is $800. You pay the remaining $200. The premiums are going to range from about $165 to about $561. And what determines the premium is basically your income. And they're going to do a 2-year look back. So if this is 2023, which it is, then they're going to look at your income from 2021, and that is what will determine your income, your premium, your modified adjusted gross income. So just to give you an idea of how this works, if your income is $97,000 or less, then your premium is $164.90. And then as you go up, as you can see on the chart, your premiums go up according to your income, your modified adjusted gross income. A couple other things. If you decide to enroll in Medicare late, meaning you're supposed to roll on your 65th birthday. There are some exceptions by that, but if you enroll late, then there is a 10% penalty. There's a lifetime penalty, and that lifetime penalty doesn't happen just make your premiums go up for 1 year. It raises your premiums for the rest of your life. Okay, so you want to make sure that you are enrolling on time. And again, if you need more help with that and when you should enroll and things of that nature, you are welcome to give us a call. We'll be happy to help you there. There are parts A and B is what's known as original Medicare. We said there are A, B, C, and D. Well, so what's C? C is what's called Medicare Advantage. This came later, and basically what Medicare Advantage is, it's operated through a private health insurance company, and it's really a bundling of A and B together. Okay. So typically with Medicare Advantage, you'll get your hospital and your doctor, but they may add in things like prescription drugs or vision or dental and hearing. So what's Part D then? Well, Part D is prescription drugs. And this is actually optional. And this is coverage that's through a private company that contracts with Medicare. And Part D also has a premium. And just like Part B, it's based on your income. The national average is just over $32 a month. And it's just, again, based on your modified adjusted gross income, 2-year look back, remember that. And the same way it works, the higher your income goes, the more your premium will be. Okay, and you can see the chart there that kind of breaks down what those next barriers are to a higher premium. Also, if you enroll late, the same thing applies, that your premium will go up throughout the rest of your life. So keep that in mind as well. Now, some more alphabet soup. Here is Medigap. Medigap is what's called supplemental insurance. And why do you buy this is because, as I mentioned before, original Medicare has no out-of-pocket maximum. So that means there's an unlimited potential liability for you if you have a year where you have very high medical costs. So Medigap helps you deal with those out-of-pocket costs. It helps cover those out-of-pocket costs. There are 10 standard plans ranging from here, alphabet soup, A, B, C, D, F, G, K, L, M, and N. And each state offers a plan. Now, what you will find is all of the plans basically offer the same coverage. However, they are not offered at the same premium level. So there will be different prices based on which insurance company you use, but the coverage offered under each alphabet is pretty much the same. So when it comes to making a decision about Medicare, here are your choices. You can either go with original Medicare, which would be A plus B. If you choose, you can add in a prescription drug plan that is optional, but you don't have to have one. Probably would recommend it, but we don't have to have one. And then you can also potentially purchase Medigap, again, to manage those out-of-pocket costs. But then you also have Medicare Advantage, which combines A and B and usually has a prescription drug component with it. So with most Medicare Advantage plans, you don't need a prescription drug. You don't need Part D because it's already included. And because you're using a Medicare Advantage plan or Part C, then Medigap is not made available to you. Okay, in fact, you don't even really need Medigap because you already have that out-of-pocket protection with the Medicare Advantage plan. Now, signing up for Medicare, we talked a little bit about this. Typically, it's at age 65, and if you enroll late, there is a lifetime penalty. So here's really the qualifier. If you're receiving Social Security benefits at least 4 months before you turn 65, if the answer is yes, you'll automatically be enrolled in Medicare Parts A and B. If the answer is no, then you're going to need to sign up for Medicare. And the reason why that's important, again, is because if you sign up late, then you will have to pay an additional premium. And that's a premium for the rest of your life, an added premium for the rest of your life. And just so also, the Medicare open enrollment period will begin on October 15th and it'll run to December 7th. This is for 2023. And that's for coverage that will start on January 1st of 2024. So what happens if you're still working? Should you enroll if you're still working? Lots of people have this. Maybe you are working or your spouse is still working and you're covered on their plan. As long as you have credible coverage through work, then you don't need to enroll in Medicare until you separate from service or lose that healthcare coverage, whichever one comes first. Even if you're over the age of 65 and you still have coverage, then once you either lose that coverage or you separate from working, then you usually have a window, an 8-month window where you can enroll in Medicare. There's a special enrollment period for 8 months, okay? And just so you know, COBRA, if you're on COBRA, that does not qualify as credible coverage.